look at the vision of Zach, it says we are following the teachings of our Lord Jesus Christ in health and healing, because Jesus Christ moved from place to place, addressing the needs, psychological needs and social needs of individual, and even the health needs of individual. So that's where we are taking our concept to make sure that we provide the health and healing at the same time. There's advantages in actually providing family planning, where you improve there's child spacing, there's economic issues where sometimes if you space your children, at least you can afford to provide for them. So I think there's social, health and economic advantages in terms of family planning. In Zimbabwe, there's what we call the National Pharmaceutical Stores. This is where all health providers in the country access their drugs, be it government and mission hospitals. So that's where all the commodities come from. And what we do is that each and every institution will make its orders based on the needs on the ground. So that's how we get them. But where there are shortages, that's where organizations like Zach come in, do a needs assessment to see if there's serious shortages. Then we work with partners to actually cover the gaps. We should make sure that when women travel these long distances and getting to the hospitals, all those commodities are there, because it's pointless to talk about the commodity and educate women in terms of family planning. And when they now come to the institution after traveling maybe 10 kilometers, even beyond, and they're told that that method is there, it discourages. Hence, we get some of them falling pregnant, and then some of them trying to terminate pregnancies in an illegal way and then harming themselves. So these are some of the things which we need to guard against to actually protect people from unwanted pregnancies and also from having abortions. Traditionally, like if you, in certain cultures, the wealth of a man is seen by the number of children he has, and also some of the ego of the men. They want to see their wives having more children. But I think there's a need to educate men to say, if a woman has children, maybe more than 6, some of them even go to 8 or 10, there's a health risk to a woman. You look at the population, the future of the country, the population of the country, all these things have economic impact on how the country is going to develop as well. And also it has household economic impact as well. So I think people should realize that this is the most important part for women as women, for men, for them to provide and have extra money to look after their family, and for the country to control the population growth to avoid poverty. So these are some of the key things which we look at them. We should not look them and look at a woman and say, this is it. Let's look at it in a global manner and address it accordingly.